This is the CBS Evening News with Scott Pelley.
Good evening. For 31 days now, the Obama administration has been telling us that Americans by the millions are visiting the new health insurance website despite all of its problems. But no one in the administration has been willing to tell us how many policies have been purchased, and this may be the reason. CBS News has learned enrollments got off to an incredibly slow start. Cheryl Atkinson obtained documents that haven't been seen by the public until now.
Early enrollment figures are contained in notes from twice-a-day war room meetings convened within the Centers for Medicare and Medicaid Services after the website failed on October 1st. They were turned over in response to a document request from the House Oversight Committee. The website launched on Tuesday. Publicly, the government said there were 4.7 million unique visits in the first 24 hours. But at a meeting Wednesday morning, the war room notes say 6 enrollments have occurred so far. They were with Blue Cross Blue Shield North Carolina and Kansas City, CareSource, and Healthcare Service Corporation. By Wednesday afternoon, enrollments were up to approximately 100. By the end of Wednesday, the notes reflect 248 enrollments nationwide. The healthcare exchanges need to average 39,000 enrollees a day to meet the goal of 7 million by March 1st. The war room notes give a glimpse into some of the reasons customers had problems. Direct enrollment, signing up directly on an insurer's website, is not working for any issuers. Experian Credit Reporting Agency is creating confusion with credit check information. Issuer phone numbers are not appearing correctly on the Pay Now page. The notes leave no doubt that the enrollment figures, which the administration has chosen to keep secret, are available. Statistics coming in, say notes from the very first meeting the morning of October 2nd, contractor QSSI has a daily dashboard created every night. But head of CMS Marilyn Tavenner wouldn't disclose the figures when Dave Camp, chair of the House Ways and Means Committee, asked earlier this week.
I mean, how do you not know how many people have enrolled?
Chairman Camp, we will have those numbers available in mid-November.
Health and Human Services today told us it's in no position to confirm or discuss enrollment figures because it doesn't have any. A spokesman suggested that enrollment was always expected to start very slowly and then skyrocket as the deadline approaches, Scott.
Cheryl Atkinson breaking the news tonight, and we'll follow up tomorrow. Thank you, Cheryl. What does a failed website cost? We wondered, so we called the government auditing agency, the GAO. They told us the money spent on the website so far comes to at least $394 million. Cheryl Atkinson has been digging into the cause of the delays in preparing the site, and she found there was a major interruption in the months before President Obama's re-election.
At the height of the 2012 presidential election campaign, it was crunch time for the Obama administration to release key instructions so contractors could work toward the October 2013 deadline. But a Health and Human Services official who was closely involved tells CBS News that in late summer the administration stopped issuing proposed rules for the Affordable Care Act until after the election. The result was what many viewed as a serious delay as contractors, states, and insurance companies awaited crucial guidance to move forward. Some of the rules were ready to go back in June or July, says one insider. Suddenly, everything was on hold. We reviewed the HHS website and found between 2010 and August 31, 2012, 109 proposed regulations were issued. Then from September 1st until late November, there were none. The flurry resumed after the election. Today, a White House spokesman told us issuing regulations was the sole responsibility of HHS. Their timetables were their own and not influenced by the White House or the re-election campaign. Whoever decided on the delay, one government source says it meant insurance companies didn't have information they needed to design their plans and calculate premiums. Another says that the main website builder, contractor CGI, didn't get all its final technical requirements until May. That includes the crucial user interface, which dictates what people see when they visit the website and how they navigate around. Without final instructions, the source says, CGI started down a path only to later discover it was the wrong path. CGI had to throw out and start over on about a third of its work. Some experts say the website should have been tested for 4 to 6 months prior to the launch rather than just days. But some of the final technical requirements weren't even issued 6 months before the launch.
Cheryl Atkinson in our Washington newsroom. Thanks, Cheryl. Today, the federal healthcare website went down again for about an hour and a half. No one is sure why. It's being taken offline on purpose every morning in the wee hours from 1 to 5 for repairs. Millions are still having trouble buying insurance on it, and it turns out that even when the website works, it may not be secure enough to protect privacy. Cheryl Atkinson has been digging into this.
As healthcare.gov was being developed, crucial tests to ensure the security and privacy of customer information fell behind schedule. Our analysis found that the deadline for final security plans slipped 3 times, from May 6th to July 16th. Security assessments to be finished June 7th slid to August 16th, then the 23rd. The final required top-to-bottom security tests never got done. The House Oversight Committee released an Obama administration memo that shows 4 days before the launch, the government took an unusual step. It granted itself a waiver to launch the website with a level of uncertainty deemed as a high security risk. Agency head Marilyn Tavenner accepted the risk and mitigation measures like frequent testing and a dedicated security team. But 3 other officials signed a statement saying that does not reduce the risk of launching October 1st. Georgetown law professor Lawrence Gostin is a big supporter of the Affordable Care Act. He helped Congress write the law to meet constitutional standards, but he's critical of the launch without proper security.
Nothing can undermine public confidence more than the fear of a security and privacy breach. You could have somebody hack into the system, get your social security number, get your financial information.
Healthcare.gov exchanges data through a massive hub that includes the IRS and Social Security Administration to verify income and identity, and Veterans Affairs for military personnel who receive special benefits. Last week at a congressional hearing, Health and Human Services Secretary Kathleen Sebelius told Democrat G.K. Butterfield that Americans have no reason to worry.
Do you have confidence in these and other measures you are taking to protect the security of Americans' personal information?
I do, sir.
While officials try to fix all the problems with the website, internal notes released today from a government meeting last week reflect a new concern that the media may begin to follow customer experiences, and in some cases, CMS fears there are fewer health insurance options than would be desired and, quote, relatively high-cost plans.
Cheryl Atkinson in our Washington newsroom. Cheryl, thank you. In her testimony today, Secretary Sebelius said, quote, "I told the president that we were ready to go. Clearly, I was wrong." One of the mysteries is why the secretary would give the all-clear after the system failed repeatedly during those tests before its debut. Cheryl Atkinson has dug up new information on this.
We've learned the website failed with a small test pool of 200 to 300 people that included employees from the government and insurance companies. The government employees worked at their own computers and desks within the Centers for Medicare and Medicaid Services, which oversaw the healthcare implementation. According to sources familiar with the process, CMS employees were provided fake personal information to enter into healthcare.gov rather than their own data and were given a date that testing would begin. However, on that date, the employees were told it was being postponed. When the testing finally took place in late September, the testers started trying to create an application. Just a couple of pages into the process, everything ground to a stop, says one source. It froze. It couldn't go forward. It crashed. A couple of days later, testers tried again and had a similar outcome. They were never able to successfully browse plans for cost estimates. It was unequivocally clear from testing this wasn't ready, says a source close to the testing. The account is in stark contrast to the testimony yesterday from Marilyn Tavenner, the head of CMS. She testified under oath she had no idea prior to October 1st that the problems were so bad.
We had tested the website and we were comfortable with its performance. The volume issue and the creation of account issues was not anticipated and obviously took us by surprise and did not show up in testing.
One question this raises, Scott, is was the head of CMS unaware of results of testing that took place inside her own agency just days before the launch?
Cheryl Atkinson with the new reporting tonight. Cheryl, thank you very much.
The Obama administration is promising the federal health care website will be run smoothly by the end of this weekend. But with that self-imposed deadline approaching, CBS News is learning another promise by the government isn't holding up. Some of those who get their insurance through work are losing their coverage. Cheryl Atkinson is in Washington. Cheryl, good morning.
Good morning, Charlie. We've learned that the government estimated all along that millions of workers will be dropped from their employee insurance under the Affordable Care Act, and for some, it's already happening. New Hampshire small business owner Nancy Clark was featured last year in a White House video blog.
The health care law is about people like me. It's Nancy Care.
But things haven't gone quite according to plan for Nancy Care. Last month, her insurer said it was hiking rates 39% starting next year. That's a $30,000 increase in cost to her.
I didn't take it seriously because I have the opportunity to go on healthcare.gov.
So Clark decided to terminate the insurance she's offered her 8 employees and turn to Obamacare. But there's been one problem after another.
We're experiencing technical difficulties. That's the nature of the beast.
Biggest problem is going to be
Virginia Beach business owner Betsy Atkinson is also canceling company insurance because her plan doesn't meet new Obamacare requirements, and she can't afford to offer employees one that does.
they're going to have to go find their own insurance. I'm sorry.
White House spokesman Jay Carney has given repeated assurances that nothing will change for those insured through work.
They don't have to worry about or do or change anything. This conversation doesn't apply to you. There is no change for you.
But in 2010, the Centers for Medicare and Medicaid Services estimated Obamacare would collectively reduce the number of people with employer-sponsored health coverage by about 14 million. The reason is some big companies will opt to save by paying the relatively small penalty for dropping employee insurance. Small businesses don't have to supply insurance and may find new policies too costly. For her part, Clark plans to help employees pay for their outside insurance and remains an avid Obamacare supporter.
I'm confident that healthcare.gov will be fixed.
Clark says since we interviewed her, about half her employees who are having their work insurance cut have enrolled on healthcare.gov. The administration told us the Affordable Care Act has slowed healthcare costs and premiums. Quote, the law is making it easier for businesses to offer coverage, just like it did in Massachusetts when employer coverage increased after reform passed. Charlie and Nora.
All right, Cheryl, thank you.
If the purchases on the Obamacare website are small, as that agency official predicted today, what does that mean to insurance companies that need large groups of policyholders for their plans to work? Cheryl Atkinson is looking into that.
Evergreen Health of Maryland is a nonprofit insurer that got started with a $65 million loan from the federal government. Just days into the enrollment fiasco, CEO Dr. Peter Bielenson had to blow up his business plan.
We actually called a meeting immediately upon learning of these difficulties with the exchange of our entire 35-person staff and said, listen, guys, we're going to have to switch our marketing strategy, our strategy of how we're going after folks.
I'm just reaching out to you to discuss your health care.
That means forgetting about individuals for now and instead targeting small businesses the old-fashioned way with phone calls and TV ads.
Neighborhood care, same-day appointments.
The 23 small co-ops across the country that are part of Affordable Care are intended to provide competition. As they adjust to stay afloat, some analysts worry that Obamacare, as designed, might not. Their biggest fear is that with the website problems, more of the enrollees will be the sickest and most motivated. If that happens, insurers would have no choice but to raise premiums, and that could cause more healthy customers to flee. In the insurance industry, it's known as the death spiral, and experts say if that were to come to pass, the Obamacare business model would collapse. Bielenson says he only knows for sure of a dozen people signing up for Evergreen so far.
If we have 1,000 members at the end of the year, that will be a problem, but we think we're far along in our business planning, and we expect to have about 15,000 or so, which would be our break even.
For context, Scott, the Affordable Care Law is counting on signing up 7 million people over the next 6 months. That averages to about 39,000 people a day.
Cheryl, thanks very much. Moving on to another important story. Tonight, we have learned that the project manager in charge of building the federal healthcare website was apparently kept in the dark about serious failures in the website's security. Those failures could lead to identity theft among people buying insurance. The project manager testified to congressional investigators behind closed doors, but our Cheryl Atkinson has obtained the first look at a partial transcript of his testimony.
Henry Chow, Healthcare.gov's chief project manager at the Centers for Medicare and Medicaid Services, gave 9 hours of closed-door testimony to the House Oversight Committee in advance of this week's hearing. In excerpts we've obtained, Chow was asked about a memo that outlined important security risks discovered in the insurance system. Chow said he was unaware of this September 3rd government memo written by another senior official at CMS. It found 2 high-risk issues, which are redacted for security reasons. The memo said the threat and risk potential to the system is limitless. The memo shows CMS gave deadlines of mid-2014 and early 2015 to address them. But Chow testified he'd been told the opposite. What I recall is what the team told me is that there were no high findings. Chow testified security gaps could lead to identity theft, unauthorized access, and misrouted data. According to federal standards, high risk means the vulnerability could be expected to have a severe or catastrophic adverse effect on organizational operations, assets, or individuals. It was Chow who recommended it was safe to launch the website October 1st. When shown the security risk memo, Chow said, "I just want to say that I haven't seen this before." A Republican staff lawyer asked, "Do you find it surprising that you haven't seen this before?" Chow, "Yeah, I mean, wouldn't you be surprised if you were me?" He later added, "It is disturbing. I mean, I don't deny that this is a fairly non-standard way to proceed." Late today, Health and Human Services told us the privacy and security of consumers' personal information are a top priority, and consumers can trust that their information is protected by stringent security standards. Scott, the author of the security memo, Tony Trinkle, retired from CMS last week. No reason was given.
Cheryl Atkinson in our Washington newsroom. Cheryl, thank you.